holistic sports, pediatric chiropractic, medicine for 32 years, including the rugby team that I coach. He's got a very active clinic. He's board certified in chiropractic pediatrics, which is only 100 at the time he got it. He got a doctor of chiropractic medicine, a Palmer College of Chiropractic Medicine in Davenport, Iowa. Thank you. And his talk is going to be about photobiomodulation, non-thermal lasers, photobiomodulation, practical applications in real-world holistic integrative chiropractic practice. Thank you for being here.
All right, everybody, we've all been really patient with our bodies have been really patient with us sitting here, so everybody stand up. Everybody just put your arms above your head. Yeah, there you go. Give yourself the gift of movement. Don't smack anybody next to you. All right, that's good enough. So have a seat. Now there's been a lot of information passed on today, and I know about you, but my hard drive's already full. But I think we need to become present so that we can enjoy the moments that we have here together. So I'm going to ask one more thing of you. I want you to sit back in the back of your chair. Put your hands on your lap. Now just close your eyes and then just take a deep breath through your nose. Hold it. And as you breathe out, breathe slowly through your mouth. And one more time, breathe in. The power of our breath, it's a gift. Hold it. And breathe out again through your mouth. And just come back to the present moment. Give yourself a big hand. So, thank you so much. I'm really honored to be here in our with Dr. Arturo. First of all, I'd like to share with you our practice mission statement. We are here to inspire people to live extraordinary lives, not ordinary, so they can be a beacon of hope for others. The Society for Acquired Resilience blows my mind. Whoa, it's like, that's just so big. That is so big. And I was so encouraged to see the younger generation to be here. It gives me so much hope that we're here together with the people that have been in practice for many decades to pass that on to the next generation. And our last speaker, you were amazing. So there's hope for the future generations. So that's a big, heavy burden on your shoulders, but take it anyway. Well, I want to thank Dr. Jeff Spencer. He was the Tour de France chiropractor that got to discover Channel team, the Postal Service team, and the Radio Shack team to 7 Tour de France's in a row, and first or second place. That did not happen by accident. So in our practice, and Dr. Bravo invited me because he saw me on the sidelines working on all the rugby kids with a cold laser when my son was playing. And so that's what my presentation is going to be about today. Also, Dr. Kirk here, all the research slides that you can see. By the way, I'm going to go really fast. If you want the data, the research, I'm not going to go deep into it because we don't have the time to do that. I'm going to put a QR code at the end of the presentation. You can take a look at that and I'll send you the information. This is all Dr. Gare. He's a Erchonia seminar researcher and a presenter as well. And of course, this man over there, stand up, please. Look at that handsome face. So our presentation, we're going to go over a few research studies on photobiomodulation. By the way, the lasers that you guys use in ophthalmology is the hot lasers, the class 4. We're going to use, what we use is the class 2 lasers, non-thermal, low level, so those what you'll see in the slides will interchange those back and forth. Also, as a practicing doctor, I would just have so much fun with these lasers. So you can see a lot of videos and practical application. I'm not one of you guys with a PhD, so my brain doesn't work that way. Like it's already full. I'm surprised it's not coming out of my eye, but you can help me with that, right? Energy medicine, the scientific basis, Dr. Jim Oshman from Philly here. Basically, we're made out of coherent light. We're all made out of light. And so the coherence and here is what the laser does is to help us allow the body to communicate with itself on a cellular level. The lasers have been used in Russia a long time ago in all fields of medicine ever since the 70s. It was adopted then as if our national health care, let's say Medicare, accepted it. That would be the equivalent of what they've been doing since the 70s in Russia. So how does the laser work? The mitochondria, that's an electron transport system. You have the complex 1, 2, 3, and 4. The lasers that we use with Erchonia has different frequencies. The 405 is the violet, the 520 is the green, which just came out about a year ago, and then the complex 4 is the red laser that we use to help the electron transport system. And really what happens is that when you shoot the laser, a low-level laser with the mitochondria, you produce ATP, which is what? It's basically the cash of the cell. So you give the body more energy so it can actually help. Now, mitochondrial diseases, there's so many things now that people have that lead to mitochondrial damage on the electron transport system. So that's what we're trying to help with, because if people need to take these medications, they need to have another avenue of approach to make sure that the ETC doesn't get too impaired for too long, which leads to different diseases. And you already know this. You saw all the mitochondrial damage. When you damage the mitochondria, it leads to all kinds of diseases, because that's the way your body produces energy. So if you have these medications that are being taken by patients, it messes up the complex 1 and 2, so the violet laser, right there, can help that. Again, it's non-thermal, so you can never really harm anybody, there's no side effects. The green laser would help the complex 3, because all these medications, again, damage the mitochondria when they're taken over long periods of time. Complex 1, 2, and 3 can also be impacted by lifestyle factors. You know, people are exposed to different chemicals, right, Eric? So talking about all the stuff that you're trying to avoid. Dr. Dan Murphy said he's been using lasers on the brain since the 1980s. This guy is so smart, he's almost in his 70s. He reads like 5 books a week, and he memorizes everything and references it when he's doing the seminars like that. I think we do that. The lasers really work. Non-laser for the brain. It enhances neuroplasticity, reduces inflammation, and it improves your cognitive function with daily use. These are some of the functions there. Again, you can have these slides if you want later on. Some studies showing the impact of it. All the scientific jargon is on the bottom there, how it influences it. Stem cells, mesenchymal stem cells, epidermal stem cells, these are all influenced by the laser. Here's one of our patients. How do you do this? Click on it. This is how you laser the brain. One of our patients. We also are fixing the cervical spine there, the curvature. So we're putting the brace on there after they've been adjusted. There you go. How do you go to the next slide? There you go. Okay, back here. Sorry. Okay, so rugby guys, concussions all the time. Many times they get concussed, they get reconcussed, they just stay in the dark room, they can't play. I hate seeing that because they want to play. And a lot of times they still play. So guess what? We have a whole protocol that we use for TBI. By the way, when these kids get traumatic brain injury, guess what happens with their gut-brain axis? They end up becoming depressed. Remember all those football players that were committing suicide? The gut-brain axis talk to each other. When you damage the brain, you damage the gut, and the whole cascade of events go down. So we have a whole protocol that we use to balance the cranial nerves using the pole laser. This is one way. This is my son who we're showing. So what happens there when he brought his neck down, the myotones weaken because the nervous system was maladaptive, So then you put the laser on there and you retest again. And then you find another area. So when you do the ranges of motion, you can find where the compromise is. You laser it, 2 seconds later, it'll actually work. So increasing the levels of ATP, dampening free radicals, stimulating glutathione, improving blood flow, these are all the effects of the cold laser as well. Here's another interesting thing. There's actually direct vascular channels that connect the skull and bone marrow through different parts of the body. So when you laser the body, the mitochondria travels to your bloodstream, it goes all over the body, so it actually can have a systemic effect as opposed to just a local effect. Huge thing with Parkinson's, I know some of our presenters are going to be talking about that. And they did a study with Erchonia, and they found actually significant statistical changes with ADLs by using the cold laser. Again, it's non-harmful. Laser and autism, tons of studies on this in terms, again, Machado. So what they did when they lasered the kids with autism, they increased their brain, the blood flow to the brain, so they're able to heal that brain faster. Again, you guys understand this, the scientists that are here, more than I do. Oh, post-surgical wound healing. You guys ready to laugh? So I was getting an implant. That's my buddy Dr. Smith there. So you see that hole on the right side over there? Well, that's pretty drastic. It's surgery. You're pounding like a big thing inside your jaw. So normally they give you medications, antibiotics, right? I'm always experimenting on myself, right? So if this stuff really works, I'm just negative about what patients tell me. So what I did, I lasered it. There's the implant. And you know, you have to wait 3 months with that thing poking at you. So I lasered it. That was like in the morning. I lasered it about 4 or 5 times. There's different frequencies, wound frequency, inflammation, acute pain, and I took the nutritional protocols that are anti-inflammatory, and also the violet laser, by the way, is, you'll see in a minute. Oh, and so I was able to sleep that night. I never filled the prescription. I had it just in case, but you don't want to be stupid, right? But I never needed it. And that happened twice because first the extraction and then the implant. So that's my own study. Don't call me in that. My cat scratched me, so wound repair. Had the laser all the time at our house. Oh, I was doing karate. This is probably like 2 years ago. We did a kick. I heard my hamstring go, oh man. So I ran over to the corner, took down my gi, not realizing it was a mirror where everybody could see me. So I put the kinesio tape, I lasered it right away, and I went back to class. I'm like, this is really amazing, right? So I went back to class, and then this, I would do this here. Even through clothing, it'll go. So I lasered myself, since I have it. And the next day, I was able to perform again. Fracture healing. If you have a fracture, no matter what part of the body, let's say it takes 6 to 8 weeks to heal, it can heal in 3 weeks. Happens all the time in our practice. And there's studies showing why. And there's a frequency, there's different frequencies. Can you see them? 220, 42, 86. And for pain, there's frequencies that you can program this in so that you can actually get the impact that you want. Athletic performance. It's been shown to improve competitive cyclist VO2. Oh, you guys know this? Bon Jovi. So he was this is on the Netflix show, by the way. He was having issues with his voice and he was almost not going to perform. So injury repair, accelerate, that's why I love having an advanced degree in sports chiropractic. You want to get those guys, right? The young kids. Okay, yeah. Sorry. It's like ice cream. So the kids, don't they play vert all the time?
Yeah.
And they don't want to be on the sidelines, right? What's that?
Not definable.
Yeah, that's exactly right. So we want to get it onto the field as soon as possible. And what it does, it again reduces inflammation, helps with it. Oh, this one, like this guy. Remember this guy? Were you here? This is right on the field, by the way. His shoulder was, he got smacked. And the kinesia tape.
Feels good actually. Usually it feels painful to bring it back.
That's like when you want to play English, you should rate like picking that picture. You can play injured, or you can keep it and put it by the line, and you can do it.
Truly a lot better. Thank you. Seriously.
It's cute. And again, randomized clinical trials of how laser therapy works. Here's another one. You know, how often does this happen?
Stop running out here.
Doing the laser to help feel faster and okay. This is what we do in our practice, sports chiropractic. Oh, here we go. Ready? Let's rock it out. Okay. Also, you can put somebody on a vibration plate and you stimulate the mechanoreceptors in the body and you laser them. Get so much better outcomes that way. This is a jiu-jitsu guy that I take care of. Put him in a vibration plate. You know, like 4 or 5 different lasers that we use. Oh, here's the cool thing. This violet one here, 405 nanometer. Here's the study. Blue light inactivates 2 strains of virulent coronavirus. So anytime you have an infection, anytime I get like that little sniffle, like, oh, this is going to go for like 3 days and you start to go downhill. So what I do, I laser it, 10 minutes later it's gone. It's crazy stuff. You can tell. Oh, here you go, little guy. This is Ryan. How old is Ryan? Hi Ryan, you're 3. Here's the heart in your hand. Today's the 20th of October 2010. We're going to use the cold laser on it and we'll see what the outcome is. This is so much clearer camera too. What's today? Today is June 24, 2011, and this is follow-up with Ryan's thumb getting really close. I still really close. Nothing, no works. Hi, say hi. So that was just two. Oh, here's the go. Kid couldn't crawl. They said it would be fine. So we used the percussor, we used the laser, release the fascial tension in that body. And of course, you gotta open up the nervous system so the body can communicate with itself. And after 6 adjustments, so that kid's life's gonna be different going forward in the future. Ear infections. So no antibiotics, no ear tubes, right? There are different frequencies that you can program the lasers on. And everything, we got stress in our lives, different stresses in our lives. If you want to take your phone out, if you want to do this, you can do that later on. There's going to be information that we can send to you. Bottom line, resiliency, you got to have adaptability. You got to get the brain and nervous system to talk to the body so you have 100% function. This is another one with a dog supposed to be dead. It's going to be euthanized. And the last thing, the future of our resilience can happen in no way if there's no communication between the brain and the body. And that's really the bottom line. The body cannot repair itself without communication. So this kid was 1 month old, did never sleep more than 2 hours, poor mom. And we adjusted it and it slept the same way. Look at the tension in the body here. Sympathetic tone. Watch the release and the adjustment. Watch it just let go. Thank you. Questions? Yes?
First of all, that was very interesting talk to see the kind of effects that the laser therapy can have across various body systems.
And that's like a quarter of what we do. That things that you can really do.
Right, and
Yeah.
like animals as well. And one question that I had was like, you talked about like your hamstring injury and how you were able to like almost immediate relief from resuming your activities. In some cases, like do you like when you administer this laser therapy, is there still like any kind of negative results that you follow up with, like for example, like imaging in case that there's like any fracture maybe that might have had relief but didn't heal properly, or do you solely like rely off of like symptomology and not the patient?
Yeah, usually the people we work with aren't that severe, like it's not like a motor vehicle accident. We sort of usually, so the way we do our practice, we do applied kinesiology, which is muscle testing. So you ask the body directly in a non-verbal way to how to communicate that. But yeah, the frequencies, for example, you could do muscle frequency, you could do acute injury frequency, you could do bone frequency on the same site. And the body just repairs really quickly. Right, how much more? Yes.
So I actually have two questions.
Yeah.
First one's a little bit like I guess a little bit more simpler. For the like acute injuries, like especially with like sports medicine,
Yeah.
did you say that the laser immediately like helps them heal, or is it like
It lets it heal faster.
faster?
So
Okay.
if you look at the research, actually, I have a part, right?
You're fine.
Okay.
Not even within the list down.
All three shifts on there. So here's what they did. They, 4 mice, they always experiment on those guys. So they would take one set of mice, they would burn, the paws. The other one, they would do the same thing. And so they would not laser this group. They would laser, watch this, they laser the one side of the paw, but not the other one. Obviously, and what they found that the lasered mice would heal 60% faster
Okay.
than the non-lasered. Watch this though. But on the same mouse, it's systemic, they both heal the same fast.
Okay.
Because remember, the mitochondria travels also in the bloodstream. So when you give the body energy, it's almost like, hey, have some here, so and the body just, it's really pretty amazing.
Okay. And then my second question was involving like Parkinson's.
Yes.
Does the laser help with only like the muscular like rigidity part of Parkinson's, or also like the neurocognitive defects that also?
Yes, both.
Okay.
Because again, you got to go deep into that. You have to keep assessing the body, finding out what it needs. Again, when you do the applied kinesiology, and also you can do other tests as well. There's a whole branch of chiropractic that's called chiropractic neurology. These are like it's a PhD program, a 3-year program. They do exactly the same training as neurologists, but now they could do things naturally.
Okay.
And they reverse things like that. I mean, the stuff that I could have shared with you, but it's pretty amazing what it can do. Yes.
Sorry, way back here.
Yeah.
Incredible presentation. I was wondering in terms of acute versus chronic injuries with sports medicine,
Yeah.
like let's say tendinitis versus a tendinosis, which is more chronic.
Yeah.
Do you see lasers have a different effect on the healing process?
The bottom line with that, like no matter how long it's been going on, it heals so much faster, right? So you guys don't know this, but that's why I'm so excited to be here. 15 years ago, I had suffered an aortic dissection. I'm not supposed to be here, right? So that's why I put myself out. And I love the fact that you young kids are here because you are the future generation. And this world needs resilience for people that live the way we're supposed to live. So I had an aortic dissection. I'm lasering myself in my hospital bed. Doctor's going, what are you doing? I'm too weak to talk to you. So I lasered it. So I went back to cardiologist 2 weeks later, and he's looking at the scars, go, it's been a month, right? It's like, no, it's been 2 weeks, right? And anytime I would have something going on, I would just laser the heck out of myself. I mean, this is like the best thing that you could really use to help yourself. Yes.
I have two questions.
Yes.
First of all, thank you for your talk. And
You're
I'm
welcome.
just, I think you convinced us all that we all need to invest in a laser. How much do these things cost?
So the Erchonia is the only laser. How many times do you see things on Facebook or Instagram? Laser, 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 right? Those are all LED. When Erchonia did their studies, they used LED as a control. They have 22 different FDA clearances out of the 25 in lasers.
Okay, so there is FDA. That would have been my next
Yes,
question.
and that's why I use this. Somebody ever comes to, ask you a question or an attorney, look at all the studies. As a matter of fact, if you go to our website, all this information about lasers on there too.
Then there's my second question,
Yeah.
and I'm not sure if I caught you correctly, but you kept referring to mitochondria in bloodstream. There's no mitochondria in bloodstream, so there's no mitochondria in, our red blood cells. So
Mhm.
is that something else that?
There's floating mitochondria in red blood cells that they found out about 2 years ago. So
Say that
they,
again.
they float through the whole body.
Okay,
They're,
that's
they're
interesting.
free living mitochondria, which are active,
Patent.
circulating.
Yes. We can send
So
you
they
the
travel everywhere for what you
we
buy,
can send
correct?
you the reference if
Yeah.
you want.
Yeah,
They've
that would be
only
nice.
just discovered
I
it.
didn't know about that. Yep.
Okay. Yes, sir.
I noticed you're using red, green, blue.
Violet. Yeah, violet. Yeah.
You're not using infrared at all.
No, the infrared is increased temperature, right?
No.
No?
No.
The thing about the red is it's
Yeah.
it's really good
Yeah.
for the surface things, but infrared penetrates so much better.
Right. And what we do with the lasers, and again, Dr. Garrett could answer more of that information for you in terms of the details about the frequencies and so on. The thing about the Erchonia that we like is that it's not so much depth of penetration, but again, it's stimulating the mitochondrial ATP. So the body can then repair itself instead of influencing, the depth of penetration.
And also you're
Yeah.
doing it through clothes. so-
Yeah, just watch. People go like, how's that gonna go to your clothes? Can you see this? It's going to my tissue, going all the way to your eyeball, and over there, that's gonna go to your clothes. So 186,000 miles per second is the speed of light, and each diode here puts out 40 billion photons per second. So there's a lot of currency that is available. Yeah, that's right. That's true. But again, that is an LED, right? There's a difference between this. And again, Erchonia has all the research to go deep. Thank you for those questions, by the way, because that is exactly why we're here. So that we can see the validity of it, not just in clinical outcomes, right? But also to make sure that the scientific community understands how the things work. They've done all the research. But I didn't want to spend time doing that. They got it. Yes?
I kind of have a two-parter as well. So
Yeah.
the first part is just kind of like, what does the protocol look like? How often would you see patients depending on the injury? And what other things do you do? So then, like you mentioned, you do adjustments in addition to the lasers. As my one part. And then the second part is just about accessibility. So how many other practicing physicians or practicing care stuff do this kind of stuff? And how expensive is it for patients?
Okay, so each laser session is 65, right? And it can last between 6 to 10 sessions, right? And also we have 4 of these in our office. Instead of you driving back and forth to the office, if you have an acute injury, we just rent it to you. You can use it at home. And then you also have to monitor, obviously, clinically, the outcomes as well. So I want to do one quick demonstration with Tenjin. I can stand up for a second. Right? Oh, give her a great hand, by the way. Remember how I was showing this? I'll be back. No, just kidding. No, hold this arm and push. I'm gonna push down. I want you to resist, right? This is what more facing you on, right? Lock the elbows straight. Good. So we're looking for myotonal weakness when there's a misalignment of the spine and you don't know it's there because it's non-symptomatic. The weakness in the muscles are microscopic, but then you don't even know it. It becomes a fit. So we can find this malfunctions before there's any atrophy or anything or pain. So push it against me, right, like that. Look straight ahead. Bring your chin to your chest, all the way down. and hold strong. Good, that's good. Hyperextend all the way back. Hold strong. Good. Turn your head to the right. Hold. Now it goes weak. Can you feel that? Stay in the middle. Hold. Really strong. Turn right. Hold. Now it goes weak. Keep your head turned there. Drop the arm. This is not going to harm you, I promise you. For Dr. Bravo, let's turn right. So what we're doing, just 2 seconds, right? Turning it back on. Look straight ahead again. First, hold the arm up. Hold. Turn your head to the right. Hold. Hold the one. Go straight ahead again. To the right. And hold. There you go. And then tilt sideways. Hold. Tilt to this side. Hold. And that goes weak. Keep tilted. Hold. And there it is. Got it? So that's how quickly it can work. There's many uses for the laser. The one thing that we do that Dr. Spencer did, it's called myotonal upregulation. So you don't just adjust the spine, that's the hardware part. The software part is doing the myotones so that the adjustments can hold better. So I think that's my time, guys. Thank you so much.